All right, we're going to do wound care. So this starts out as a clean procedure, goes to a sterile procedure, and then goes back to clean. So of course, before you start, you need to gather all your supplies. So you need 2 packs of gauze with 2 pieces of gauze in each. You need an abdominal pad, tape, a plastic ruler, 2 Q-tips, alcohol swab just in case your tape gets sticky, and then you need sterile gloves and saline. You also need clean procedure gloves, which I have behind me. Once you've got your supplies, you can check your order, your MAR for an order for medications for pain, as well as an order to do wound care and what kind of dressing change or wound care that you need to perform. So I'm going to knock on the door and introduce myself. Hello, my name is Erin. I'll be your nursing instructor for the day. I'm going to change your dressing on your thigh. Could you give your pain a number out of 10 for me, with 10 being the worst pain? Gives it a score about a 6. I would of course give him some pain medication. IV pain medication, you can wait about 30 minutes. Oral medication, wait about 45 minutes to 60 minutes before starting your wound care. Come back and readdress your pain. How's your pain doing? Say it's doing better. Is it okay now if we go ahead and proceed? He says yes. Of course, as you know, we're going to do your dressing care. It takes about 15 to 20 minutes. I'm going to have to roll up your pant leg just so I can expose the area of where your wound is. If at any time you need to stop or take a break due to pain, just let me know. You can raise this arm over here, or you can just tell me that you need to take a break, and we'll go from there. Is there anything else I can explain for you right now? No? We'll go ahead and proceed. So I'm going to just roll up his pant leg and expose our dressing. I'm going to wash my hands and put on gloves. I'm going to start by taking down our dressing. So I'm going to walk off the tape by holding the skin down tight and slowly taking the tape off. If your tape is really sticky or your patient has very fragile skin, you can use alcohol swabs or you can use saline flushes to kind of help loosen the adhesive. But we want to make sure we go nice and slow as to prevent skin tears and further skin breakdown. Now that I've taken the first layer off, I'm going to assess the drainage, what kind, how much, and then if it smells. And when we do that, we're going to say it's serosanguinous, which is a pinkish color because it's a mixture of serous fluid and blood. It could be sanguinous, which is just blood, which would be red, or it could be serous, which would be a yellowy fluid. If it's greenish, thick, or green, or yellow looking, it's more purulent. And then we measure how much by a percentage. So 50% would be half the pad, 100% would be the whole pad. You kind of go from there. And then we throw it away in a biohazard bag. So I'm going to grab the biohazard container before you get over there. Of course, I would change my gloves since I touched the trash can. All right, so I've with my hands, washed and changed gloves. I'm going to continue taking out my gauze. So I'm going to go nice and slow, and of course if it's stuck to our patient, we can always use saline to kind of help loosen. So nice and slow. And again, we're going to assess what kind of drainage and how much and if it smells. And then throw in our biohazard. And continue taking out the dressing until it's completely empty and all you see is the wound bed. So every piece of gauze or part of the dressing needs to be assessed. Alright, now that his wound bed is empty, I'm going to then take one of my packs of gauze. If my hands are visibly soiled or anything, I would of course take my gloves off, wash my hands, and put on a new pair. Just clean gloves at this point. And I'm going to take one pack of gauze so that we can clean. Make sure that your table is waist height, and make sure that your bed is also waist height. When you open your packages, this set doesn't need to be sterile, but it doesn't hurt to practice opening your packages the same way every time. Open away from you using your 1-inch borders and not opening onto any packages. Alright, so I've got my packages open. I'm going to use my saline and get my gauze wet. I'm going to then separate and squeeze out the extra. I'm going to start from the top and split it into quadrants and go from top to bottom. So I'm going to wipe from the middle out, fold, middle out, throw away. Take your second piece of gauze, bring out the extra, and again fold and start from the middle out, fold back and middle out, and throw away. We are only cleaning the outside part of the wound, as we are not going to clean the inside of our wound. Alright, now that it is clean, I can go ahead and assess our wound. So if again my hands are visibly soiled, I will change my gloves, wash my hands, and put on a new pair. I can throw the trash away. And I'm going to assess my wound. So when we assess our wound, we look at the outside of our wound as well as the inside of our wound. We want to make sure that our edges are intact, that they're maybe not rolling, they're not macerated, maybe that there isn't any further skin breakdown on the edges themselves from the dressings. When we look at the inside of the wound, we want to make sure that it is maybe a beefy red color or there's some granulation tissue to make sure that it is starting to heal. Black spots would be eschar or little spots of necrotic tissue. And then if we have purulent or drainage, we would need to remove that as well as slough. Eschar and slough would have to be removed by your physician, just underneath with a sterile debridement. So when we go to assess our wound, we have to do depth. So you have a package of Q-tips. You need to just open it slightly so that we can keep the one sterile and one not. And then you can push your Q-tip up from the bottom so that you can grab it at the top and leave the second one sterile. Alright, and then when we go to measure our depth, we're going to put the Q-tip in the deepest part of our wound, just lightly. Let your patient know what you're doing. Mr. Howland's going to put a Q-tip on your wound. It may be uncomfortable for just a moment, okay? You're going to put it there lightly and scoot your fingertips down to where you barely touch the skin. And then that is how deep it is. When you measure it out, you're going to go on here. It looks about 1.5 centimeters. Always measure your wounds in centimeters, length, width, and depth. You can go ahead and throw that away. Now I'm going to measure the length. And when we have plastic rulers, anything, yes, they are clean, but it is just to prevent any chances of infection. We do not lay the rulers on our patient's skin, so we kind of just do your best to estimate. Looks like 11 centimeters long and 1.5 centimeters wide. So it's 11 by 1.5 by 1.5. I can set my ruler off to the side. We have measured, we have assessed, we've looked at all of the drainage and everything. Now it's time to repack our wound. So this is the part where we become sterile. I'm going to take off my gloves, wash my hands, make sure my table is still clean and my patient's still comfortable to continue. I'm going to get all of my supplies ready. So I need to have my tape. I need 2 pieces of tape that are going to be about 1 inch longer than the wound itself, so that it can stick on all sides of our dressing. That one's a little bit longer, but that's okay. I'm going to set up my station in the order that I use my supplies. So it'll be gauze first, and then Q-tips, and then our ABD. So everything you don't need on your table before you open your packages, get rid of. So I don't need the tape, alcohol swab, or a ruler, so I'm going to set it on our back table. Make sure that you don't leave your back on your patient for too long, and I still have room for all of my supplies. So I have my sterile gloves, ABD, gauze, and Q-tips, and tape, and sterile saline. I'm going to start by opening my packages away from me. Nice and slow so we don't knock the gauze out of its package. And then I'm going to open my Q-tip package. This one's tricky because it will kind of flip our Q-tip out of its package. It won't open all the way, but it's enough that I can still reach my Q-tip. And then my EVD. Now, once my packages are open, I can't reach over the top of them. So what I need to do is I need to reach around and get my saline wet, and then set it back. Making sure that I still have enough room to open my sterile gloves on the end. Keep in mind of where all your packages are so that if I bump my table that they don't slide into each other, and that I still have room on the end to open my sterile gloves. So of course, before you open your sterile gloves, you need to check your packaging, make sure it's the right size, it's not expired, make sure that there aren't any holes or damaged areas on our package. Then we can continue. Make sure that you have washed your hands prior to opening all of your packages and your gloves. I've taken all my rings and my watches off, I've rolled my sleeves up, I've got everything off of me that will be in the way of my sterile field. Saline is going to be in the way. Remember to use your 1-inch borders. And you're going to pick up with your non-dominant hand and slide your glove onto your dominant hand. And then again, I'm going to scoop under, but I'm going to hold my paper just to make sure it doesn't slide. I'm going to scoop up and keep my thumb out of the way and put my glove on. Now my gloves are on, I can adjust to make sure there aren't any gaps in my fingers. Looks good. And to get any extra papers off of my table and keep my hands between my shoulders and my waist. I'm going to then pick up a piece of gauze and separate them. I'm going to wring out the extra, and then in order to pack our wound, I'm going to stretch out the gauze a little so that it's just one single layer, and then I'm going to wad it up in my dominant hand so that it's not going to touch my patient's bedding or their gown or anything along those lines. I'm going to then take my Q-tip out of my package very carefully. Okay, still sterile. And I'm going to pack. I'm going to put my gauze in my non-dominant hand so that I can control the Q-tip with my dominant hand. I'm going to start in the widest part, and I'm going to try to just feed the gauze back to the narrow part, so that I can have just one layer of gauze on my wound bed. I want to cover the entire wound bed. You need to make sure that your Q-tip doesn't touch the outside skin here, that your gauze only touches the wound bed itself. Just going to leave a little tail in the middle. Make sure that it's small enough that when you put your ABD on that it's not going to flop over and touch your patient's skin. And I'm going to make sure that all of the gauze I just packed isn't touching the outside of that wound at all. I'm going to pick up my second piece of gauze and do the same thing. Spread it out, wring it out, and wad it up in my non-dominant hand. And then start in the widest part and feed the gauze back to our narrowest part. Just enough to get a thin layer on our patient's wound bed. two little tails in the middle, so it's easier to pull them out for the next person. I need to remember how much and how many pieces of gauze I put into my packet or my wound. I'm going to throw my packages away. Never put anything back onto the sterile field. Alright, so I'm all packed. I'm going to pick up my ABD, or my abdominal wound, and it's got a blue line on the outside. That blue line is going to be out, or glued to the bed. I'm going to put it over my patient's wound. I'm going to hold with one hand, and I'm going to tape on the top first. Nice and gentle. Let your patient know that you may feel some pressure just from us pressing on his leg to put tape down. And then we can tape our bottom. If I had started with the bottom, the top part would have flopped down onto the bed and broken our sterile field. Now that we've got it completely dressed, it's all covered, I need to make sure that I put the date, time, and initials of whoever changes dressing. So it'd be let's say today's 2nd of January, I know it's not, but 1/2/20, and then be 1400, and then EG. So make sure then I document everything appropriately in the chart. I need to make sure that I tuck my patient back. If my hands are visibly soiled at that point, of course, change your gloves before tucking your patient in. My gloves are okay, so I'm going to tuck them back in, make sure both side rails are back up, and then I drop the bed down to the floor.
Uh-oh.
So pretend it's all the way down, and then all the bed rails are up. Make sure that you address your patient's pain again. Mr. Howell, how's your pain doing? Again, a scale from 0 to 10, could you rate your pain? I'll say maybe a 3 or 4. Say, okay, I can see if there's something else on our medication list that we can get you to kind of help tide our pain over. If they say yes, that's fine. We can get them something else from our MAR and just make sure that it's appropriate. And then we can go from there. Typically, pain medications, your IV, Dilaudid, or morphine, or fentanyl, those medications are going to be used for severe pain, so ratings from 7 to 10. Our Percocets or our Tramadols are going to be used typically for pains for 4 to 6, and our Tylenol will be used for 0 to 3. So make sure you're administering those in the appropriate pain ranges.